I think I'm always thinking about being careful, being
Mm,
steady, and I love what you said about the doses in the right amount and in a contained environment with the relationship. I just love that, and
mm,
it really speaks to me. And um, the one of the things I've come to understand is that, often the intensity of the work that people do and the strength of emotion associated with that work can disrupt people's capacity to think. And emotions can be so intense and disturbing and unbearable that me and other people that do work, we develop defensive processes to deal with the emotions. And so I'm always
mm,
quite careful about it's not my job ever to go in and say, get rid of these and here's a better way.
mm.
I suppose what I hope that I can offer is a safe, consistent frame in which we can make sense of the work.
Yeah.
And I do that with the support of my own supervisors who are kind of
Mm,
keeping an eye on my blind spots and sort of
mm,
watching my pace with the work. And I think that's very important. I think the defensive processes in practice serve to protect workers and
mm,
sometimes foster carers and children themselves. Um, and I think from the workers' point of view, if they did not have these defenses, they couldn't endure the work.
mm.
But the absence of understanding them and the
Yes.
need to kind of lower them when appropriate can disrupt practice. And I suppose that's what I'm interested in, kind of thinking about very gently and very
Mm,
carefully, of course, in the context of a relationship. And I think it's very important to think as well that some people just don't want to reflect. Some people
mhm.
don't want to do it. And some people are not ready to do that. And I have to say, if I had gone to the Tavistock 5 or 6 years earlier, I would be one of those people. And so I think
Mm.
when we're ready, sometimes we come to that and sometimes we don't. And yeah, I'll stop there.
It's
Could keep
such
going.
a yeah, it's such an interesting field, and I think that self-awareness, again, we come back to the idea of self-awareness that we were talking about a little bit earlier. And it's not, as you say, and I really like this, it's not about getting rid of your defenses, it's just being aware of them. Um,
Exactly.
and being, I probably have approached my career on a slightly different tack, but very much. I mean, it was memorable. Let me just say, I didn't get the job, by the way. But I think there are other factors at play there. But um, I've I've always found our, as I said earlier, our own experience as being a very rich source of understanding of others. Um, And as you say, the work is difficult. The work is it's confronting. A lot of people go into child protection work with the intent, the idea and intent that they're going to help families. And so, um, what workers are required to do in terms of ensuring safety of children, it
Mm.
kind of it can run counter to the very reasons that they get involved. And you're probably aware, but and this is where this very much there's a lot of attention, at least here, being given to kind of moral fatigue, the idea of moral fatigue, the idea of working in an area that and performing in a way that runs counter to your own values and those reasons why you entered the work. And yeah, you would need your defences in definitely in those circumstances. But um, what we don't want is a situation where people stop thinking about what they're doing and
Exactly.
stop thinking about how their own place in that dynamic.
Yeah. And I guess I think that's where the use of some theory and also the use of kind of a good supervision or reflective practice model can help if and when it
Mm,
can be taken up. And yeah, yeah.
yeah, yeah. Um, so I guess just I don't want to ask a question that kind of goes over some territory that we've already gone over, but are there any further comments that you would make about how you see um, reflective supervision practice, including, perhaps from a range of theoretical stances, but particularly from the psychoanalytic systems one. Are there any further comments that you would make about how that benefits people working in this space and ultimately the clients who they're delivering a service to?
Yeah, I mean, I think it's important to say, first of all, that the getting in touch with our emotional experiences at work and also having a sense of what's just happened in a practice encounter, it does require capacity to kind of, and stamina, and it does require us to get in touch with and kind of stay in touch with some very difficult thoughts and emotions. And in a paper that I wrote, I'm not sure if this is the one you read, but with some social care workers, I talk about this in much more detail. But essentially, what I kind of suggest is that in moments of great distress, including survival and the bereavement of the kind that we've written about in that paper, it's very hard to connect with experience, sense of it, and to trust another with that experience. And I think the worker's capacity to engage with their own emotional experience is complicated by what Bion refers to as this idea of a taxon linking. And this is kind of the process that we use to destroy thoughts and feelings associated with frightening experiences. And it sort of usually occurs when the experience kind of severs the capacity of us to think about them. And that often happens with the death of a baby. And in that paper, I speak about how creating a space to think and to bring the work in written form and to sort of present the work to a gentle and welcoming and kind group where the focus is not on a solution, but on deepening and expanding the practice experience. I think that can offer something very therapeutic and safe. Yeah, and I think what I have found is that it can lead to deeper understanding and meaning around the work. Yeah.
Yeah, it's almost. I mean, I'm thinking of constructs or concepts that are floated around, I guess, in the childhood trauma and child and family welfare space. But one of them is the idea of modelling the model, and I've been talking about it for a long time. I'm not sure if it's in the first edition of my attachment book or not, but I've always been very much drawn to ensuring that my practice and the way in which I interact with people is very much aligned with how I want those people to then in turn interact with other people.
Yeah.
So if we want people to interact with others with whom they're working in a therapeutic way and establish a therapeutic alliance with them, in some senses, the supervision arrangement that we have with it, or the supervisory relationship, is going to overlap with a therapeutic process, perhaps significantly.
Yeah. I think to have a safe kind of space that's kind and gently challenging, practitioner can bring their work and make sense of that work is priceless. And I feel that it's directly connected to the child's and family's experience, exactly as you say. Yeah, it's very important, especially I think right now, I think we live in a left-dominated brain, sort of a left brain-dominated society where it's all about tasks and procedures and processes, and where there's more opportunity to distance ourselves from children and families than ever before. And we're at risk of acting and staying out of touch with reality by discounting the reality of other people's experiences and of our own experiences. And I think that the result of that is that the meaning of the work progressively becomes less clear.
Yeah.
And we find it very difficult to find reparative opportunities. And it's these opportunities that fill our cup that make us feel a bit better about the work and make us feel a bit better about ourselves in the work. So supervision and kind of safe reflective practice is very important there. And good supervision in Wilfred Bion's terms, and you've mentioned it, you mentioned it earlier, you mentioned it, when we started, is psychologically containing. and can provide practitioners kind of solid support. Yeah.
It's interesting, isn't it? When I think back over the supervision experiences I've had over the years, and especially especially in psychology in Australia, I know it's different in the UK and in Europe, really moves quite significantly away from psychoanalytic thinking into other areas. Now, so Nicola, I was wondering, this is kind of bringing together a few questions and ones that I've given you notice of and perhaps not given you notice of, but
God.
bringing the threads together. I'm wondering if you were invited by an organisation to come in and offer or deliver supervision to staff. When you go into when you're meeting with the individuals who are seeking to engage you, what would you say to them is the supervision approach you would take or recommend? What would it look like?
So it depends on the organization, of course, that goes without saying. It depends on the context and the role and the task associated with the job. But, you know, my sense, what I think I'd find myself saying is that supervision should be regular. It should occur in a safe space, whether it be online or in person. I believe it should happen with the supervisor has had some supervision training. I think it should include attention to the worker's professional development, their personal experience, and their working role and associated task. What I would say to workers, I think this is really critical, is that when we are at work, especially in the human services, we bring all that we are to that work. And it's to say that we leave our personal lives at the door. And much research shows us that this just doesn't happen, especially in the spaces when we're working with trauma and when we're meeting people with who look similarly to our own loved ones, who act similarly to our own loved ones, children, nieces, nephews, parents, partners. But in supervision spaces, we are interested in the intersection between the work itself, your personal self, and your professional role. Often supervisees will say to me, you know, is this therapy? And here's where a good supervision model is very important, and the supervisor's own supervision consultation is really important. We have to keep our eye where it should be. We can't be going off track. And the model keeps us safe and secure in that space. We are interested in the intersection between the personal and the professional and the work itself. And therapy, for those of us who've had therapy, focuses on us as a person, on our personal experience. Yes, of course, the work might come into that, but you see, the main focus is on our own personal kind of emotional, psychological journey. The supervisor, of course, the personal experience often comes into the space, but the supervisor's job is to focus on how and why it's connected to the work. And that's where the supervision model is really critical. And supervision should be underpinned by a model that's known very explicitly by the supervisor and the supervisee. Of course, I personally use the seven-eyed model by Peter Hawkins. And I find that really helpful because it also places an eye on the context in which the supervision takes place. So you can see how this connects with my like for the system psychodynamic thinking. Of course, I'll bring my own theories and influences, but the model keeps the supervision focused and really on track in my view.